pot, Mary Jane, weed. These are just a few of the names for the drug marijuana. In today's society, there is a lot of talk of decriminalizing the use of marijuana for medical purposes and some for using it for recreational purposes. So it is important to note for the public to know the effects of marijuana on the brain. The National Survey on Drug Use and Health in 2003 found that 94 million Americans aged 12 and up have tried marijuana at least once before their senior year of high school. Within minutes of smoking the plant, the short-term effects begin to take place. The initial high and desired effect of smoking marijuana decreases the ability of the brain to maintain memory and also affects the way that the body moves, such as reaction time and coordination. Also, the heart, within minutes, the heart rate of the user, which would normally be 70 to 80 heartbeats per minute, increases from at least 20 to 50 beats per minute, or doubles, increasing the risk of heart attack 4 to 5 times more. The long-term effects of marijuana can lead to psychosis, depression, anxiety, and schizophrenia. Memory loss, and also chronic users have trouble shifting their attention from one thing to another because their brains have been affected so much. Marijuana is usually thought to be a harmless drug. As you can see in this diagram of the brain, the colored parts are where brain is affected in the movement, the blue. The green is where the memory is affected. So it's covering a large part of the brain. It affects the way that the brain produces dopamine, which is the chemical in your brain that causes you to feel pleasure, and things like that, relax, lay back, which is why many marijuana users use it, because it helps relax them and causes depression. Contrary to popular opinion, marijuana can be addictive. Of 6 to 9 million Americans surveyed in having been in drug treatment, 4.2 million of them report being dependent or abuse marijuana. 15% in 2002 in drug treatment programs, pot was the primary drug of use. Although doctors have found that there are many positive medical uses for marijuana, many doctors have found that marijuana, the long-term effects of the smoking, and also mental health conditions associated with it, found that it is not conducive for their patients to take it. There are 50 to 70% more carcinogens in marijuana than in tobacco, causing the risk of developing cancer more. Many users have found that they missed more work. It affected their frontal lobe. They developed a chronic cough, bronchitis, head, neck, or lung cancer is a risk. Many doctors have found that the synthetic drug Marinol, which provides a better delivery system of THC, calming the nerves, things like that, is a better alternative rather than prescribing the plant for patients to drink or smoke. Marijuana, although it is considered a harmless drug, leads to harder drug use in the future, which, in conclusion, marijuana needs to be informed. Many people need to be informed of the use of marijuana and the effects on the brain in order to make a decision on whether they would like their doctor to prescribe it or whether it should be legalized for more widespread use. Thank you.